So the recovery time for our body contouring procedures are all across the board. If you have a more non-invasive procedure, likely there will be zero downtime. Our Evolve X and our Sculpt treatments, as well as the True Sculpt 3D, you're a little red afterwards, but you can kind of go on with your day. There's really no downtime. Our Morpheus treatment and our body type treatment are much more invasive type treatments, which do require more downtime. With the Morpheus 8, patients are often red, and you can see where they have had the microneedling treatment. The area can take on the body up to 2 weeks to heal. For the body tight, the patients usually heal fairly quickly. The skin heals fairly quickly, but they need to wear a compression device. For the body, we recommend 24 hours for a minimum of 2 weeks. They will receive the best results if they wear the compression device 24 hours for all 6 weeks. We can only do a certain surface area with each treatment. So let's say a patient comes in for their initial consultation and maybe they have a little extra abdominal fat and laxity, but they're also concerned about the back of their arms, and then they're also concerned about maybe their inner and outer thigh. Well, that's going to be multiple body areas. Safely with our devices, we can only treat a certain number of body areas at once. So we'll likely have to prioritize which areas we want to treat first, and then we'll decide the appropriate either non-invasive or more invasive treatment. With some of our invasive treatments, we can usually treat a little bit larger surface area. With our non-invasive treatments, and if we're doing more fat destruction, and that fat has to be filtered out through our lymphatic system and not actually a manual extraction like liposuction, we can only treat a certain surface area for that to be as effective as possible for a patient. So we might be able to do what we call 6 treatment areas or 6 blocks. So maybe a lower and upper abdomen, that might be a block of 4, and then the back of the arms would be a block of 6. That would be all that we would be able to do in that first treatment series. And then if we're looking at maybe adding legs, or flanks, we could do that in another treatment series, but that would be 2 completely separate series of treatments. I think it is just the American way in 2023 that we all want that immediate gratification. So a lot of our patients would prefer that more invasive result with the less invasive downtime. So it's just figuring out, where the patient's at, what's going to work for their lifestyle, what results they're trying to achieve, and then we can come up with the best treatment option. I would never want to suggest maybe a more downtime treatment with a patient that I know wouldn't stick to the downtime regimen, and then risk either an adverse event or not getting the results that they were expecting.